Hey everyone, and welcome. Today, we're going to talk about something that pretty much all of us have felt at one point or another, acidity. We're going to break down what it is, when it's maybe not a big deal, and, more importantly, when it's a signal your body is sending that you really need to pay attention to. All right, let's get right into it.
You know the feeling, right? That uncomfortable burning sensation that creeps up after a big meal, maybe a spicy one, or after a really stressful day. We've all been there. But here's the thing. How do you actually know when that familiar feeling is just heartburn or when it's a sign of something more serious? That's the big question we're tackling today.
So, just to make sure we're all on the same page, let's quickly define what we're talking about. Acidity, what most of us call heartburn, is really just what happens when that super strong acid in your stomach decides to travel the wrong way, up into your esophagus. And that's what gives you that classic unpleasant burning feeling in your chest.
And first things first, let's be clear, getting heartburn every now and then is totally normal. Seriously, a little bit of it after a big holiday dinner or trying that extra spicy dish, well, that's just a shared human experience. It doesn't automatically mean something is wrong.
A lot of the time, the triggers are just part of life, Things like spicy or greasy foods, maybe a little too much caffeine to power through the day, skipping meals when you're busy, or just plain old stress. Even some common pain relievers can set it off. It's all stuff that can cause a temporary flare-up.
Okay, but here's where we shift gears. We've talked about the common, everyday stuff. Now, let's get into the really important part, the warning signs. The signals that tell you this is more than just heartburn, and it's time to talk to a doctor.
The first huge red flag is all about frequency and intensity. Think about it. If you find yourself needing antacids more than a couple of times a week, every week, or if the pain is so bad it literally wakes you up from a dead sleep, your body is screaming at you. This isn't just a minor annoyance anymore. That constant acid exposure can cause real damage.
Here's another one to take very seriously. A constant feeling that food is getting stuck somewhere in your throat or chest. It's not just a weird or uncomfortable feeling. It can be a sign that there's some narrowing or damage happening in your esophagus, and that's something a doctor absolutely needs to check out.
We all get nauseous sometimes, but if you're dealing with nausea and vomiting that just won't quit, we're talking for several days, that's a whole different ballgame. It can lead to dehydration really fast, and it usually points to an underlying problem that needs a proper diagnosis.
Now really pay attention here. If the number on the scale is going down and you're not even trying to lose weight, especially if it's happening alongside all these acidity issues, that is a major warning sign. This combination is something a doctor needs to hear about right away because it could indicate something more serious.
Okay, this one might be a bit uncomfortable, but it is so important. If you notice your stool is black and tarry, that can be a sign of bleeding higher up in your digestive tract. If you see bright red blood, the issue is likely lower down. Either way, this is never normal, and it means you need to get medical help.
And look, some symptoms are non-negotiable emergencies. If you are ever vomiting blood, and sometimes it can look like coffee grounds, or you have a severe crushing pain in your chest, do not wait. Don't try to tough it out. This could be a sign of serious internal bleeding or even a heart attack. Call for emergency help immediately.
I know, hearing all of that can sound pretty scary, but the process of getting help shouldn't be. So let's pull back the curtain and demystify what actually happens when you go to the doctor for these symptoms so you can feel prepared and a little less anxious about it.
Honestly, the process is usually really straightforward. It all starts with a simple conversation. Your doctor's just going to ask you about what you've been feeling, what seems to trigger it, and any medications you're on. Then they'll likely do a gentle physical exam, and only if they think it's necessary, they might suggest a few other tests to get a clearer picture. It's all about finding out what's really going on.
So, speaking of getting expert care, what does that actually look like? Well, let's take a look at the philosophy behind a hospital that specializes in this, Arka Anagraha. Their entire approach is built on this really powerful idea of mixing top-tier medical expertise with truly patient-focused, compassionate care.
This quote really says it all, doesn't it? It's not just about having the fanciest equipment or the latest procedures. It's about delivering that cutting-edge treatment with a real human touch, making sure that you, the patient, feel supported and cared for every step of the way.
And that whole mission, it comes directly from the founders. You've got this incredible combination. Dr. Ramesh Makam, who is a true pioneer in surgery and has literally trained thousands of other surgeons. And you pair that with the holistic approach of Dr. Saraswathi Ramesh, an expert who champions preventative wellness. It's that blend of world-class skill and a focus on your overall health that makes their approach so special.
And an approach like that isn't something you just create overnight. It's a legacy that's been carefully built over decades and decades of practice, earning the trust of patient after patient.
Just look at this number for a second. 45 plus. That represents more than 4 decades of deep surgical experience from Dr. Ramesh Makam alone. Just try to imagine the level of wisdom, skill, and intuition that comes from dedicating that much of your life to caring for patients. It's incredible.
And that incredible expertise isn't just in one corner of the hospital. It stretches across a whole spectrum of specialties. You've got advanced surgical fields, comprehensive medical care, and even departments dedicated to wellness and mental health. It's basically a complete ecosystem designed for your well-being.
But in the end, this is what it's all about, right? All the experience, all the technology, it comes down to how the patient feels. And when you read something like this, from a real patient, talking about skilled hands and a compassionate approach, well, that tells you everything. That's the magic combination.
So we'll end with this thought. Your health is, without a doubt, your most valuable asset. We've talked through the difference between a minor issue and a major warning sign. Your body is smart. It sends you these signals for a reason. So the only question left is, are you listening?